This is Dr. Stephen Harkins. Welcome to Anatomy Coloring Book, page 64. Muscles of the posterior leg. We've already discussed the muscles of the anterior and lateral leg. And we talked about their origin, insertion, and action. The origin, the insertion, and the action. And as we work through muscles throughout the body, you're always going to need to know these three properties of muscles. Let's start with a muscle we all know called the gastrocnemius or the gastrocnemius. And it's the calf muscle that it's the common calf muscle. You refer to it as the calf. It's this muscle right here. And you can see that it has an origin point up here that sneaks underneath the posterior knee. This is from behind. We're looking from the posterior view here. And you can see it has a medial head and a lateral head. And you can see in a well-defined person, you can see this sort of definition between the two. And we have the Achilles tendon here. It sort of narrows into this very, very strong cord back here called the Achilles tendon, and it attaches to the calcaneus. And that's the gastrocnemius or gastrocnemius. A lot of people shorten it and call it the gastroc. And here you see from the side here, here's the gastroc with the Achilles tendon attaching on the calcaneus. In the medial view, here, the inside view, this large muscle here with the Achilles tendon and attaching to the calcaneus. Of course, that is the gastrocnemius or gastrocnemius. A lesser known muscle of the calf is the soleus muscle. And here you see the soleus right here. Many people don't know about this. It's kind of a forgotten muscle. And it is in front of, it's in between the, right up here, in between the gastroc and the tibia. And it also uses the Achilles tendon, attaches to the Achilles tendon through the calcaneus through the Achilles tendon. And here you can see it's a wider, kind of flatter muscle than the gastrocnemius. And you can see it right here underneath the gastroc. And here it is cut away here. To show some of the deeper muscles. And the job of the gastrocnemius is plantar flexion. It pushes by pulling upward, the gastrocnemius and the soleus, both of them, by pulling upward on the calcaneus. What they do is by leverage, and the joint is in here, they wind up pushing down the ankle down into plantar flexion. So it's like a hinge joint here at the ankle, the mortise joint or the talocrural joint. When it pulls up here, it creates a lever that pushes down into plantar flexion. And here's the soleus muscle from the side view. Sort of flatter and deeper than the gastrocnemius. Now, let's talk about how they attach to, well, let's talk about their origin and insertion. Here's the origin of the soleus muscle here, that longer, flatter muscle that lies underneath or deep to the gastroc. And it originates here on what's called the soleal line, the posterior tibia, the back of the tibia, and also in this area here of the fibula. But it originates both at the fibula and the tibia. In the proximal upper portion of the tibia and the upper posterior portion of the fibula. The insertion point of the soleus muscle, of course, is the calcaneus. Where is it? Right here, this point. So the soleus muscle attaches. You can imagine if there's a band or a string, if there is, called a muscle and tendon, reaching from here to here and here to here, what would it do? And you can see how it would push the toes and the foot down into plantar flexion. So in review, soleus origin, the posterior proximal tibia, posterior proximal fibula. Insertion is into the Achilles tendon here, into the Achilles tendon right here, inserting into the posterior calcaneus. Now the origin of the gastrocnemius, interestingly, is not on the tibia or the fibula. It is actually reaches across the, see these areas right here, reaches across the knee joint, reaches across the posterior knee joint, and onto the posterior femur. So that's the origin of the gastrocnemius, the posterior femur. And of course, the insertion is also through the Achilles tendon right here, back here, onto the posterior calcaneus. And here you have a look at the origin of the gastrocnemius, sort of cut off, sliced, so that we can see these other deeper muscle. But that gives you an idea of what they look like when they're attached. Of course, here's the Achilles tendon right here, attaching to the calcaneus. So they are both plantar flexors of the foot and ankle. Let's talk next about the tibialis posterior. Tibialis posterior muscle, also on the back of the leg, the posterior, we talked about the tibialis anterior in the previous lesson, but on the back of the leg here is the tibialis posterior. And you can see it attaching on the back of the leg and then wrapping around to the medial side, this tendon wrapping around underneath the foot, the bottom of the foot there, and we'll talk about exactly where in a moment. But let's move on to the flexor digitorum longus. The flexor digitorum longus is this muscle right here. Deep underneath, mind you, the gastrocnemius is pulled away. It's cut away. Cut away, it's no longer there. And we're looking at the deep muscles of the posterior leg and the back of the leg, the back of the tibia. And you can see its tendon wrapping around the medial malleolus as well, and it's here, it's cut off. But you can see a better look at it here. The flexor digitorum longus. What do you think it does? It flexes the digits. And it's a long muscle with long tendons all the way down to the distal phalanges. Whoop, not that one though. That is a different muscle there. This flexor tendon underneath your foot to the 4 digits there. Now, the flexor hallucis longus is right here. You can see more on the lateral side, and it also wraps in and around here underneath to the big toe. So these three muscles, the flexor hallucis longus, the flexor digitorum longus, and the tibialis posterior, all deep to or underneath the calf muscle. And here, once again, you can see this calf muscle, excuse me, has been cut away right here. Here's the Achilles tendon, and here's the gastroc, and here's the soleus, all cut away so that we can see what's underneath. And what is underneath? These three muscles, the tibialis posterior, flexor digitorum longus, flexor hallucis longus. So let's talk about their specific attachment sites. The tibialis posterior, as you can see, right here, originates on part of the tibia, the interosseous ligament, and the fibula. And it inserts on various areas, the base of the metatarsals here, and underneath some of these tarsal bones, the cuboid, cuneiforms navicular. So the base of the metatarsals, as well as the base of the first four metatarsals, 1, 2, 3, 4, as well as the navicular, cuboid laterally, and the cuneiforms. And here you can see it doing exactly that, wrapping around and under, and actually probably has an attachment right here as well, on the bottom of your foot, the tibialis posterior muscle. And of course, its job is to also plantar flex the foot, but it also is an inverter of the foot. It will also, as you can see, it not only will bring the foot down in plantar flexion, but it'll also invert the foot in this inward. The flexor digitorum longus will originate here on the posterior tibia, right in the middle of the shaft of the tibia, and it inserts down all the way down here to the base of the phalanges, or the base and the head, actually, the base of the distal phalange, and also the middle phalanx. So it will come around and wrap underneath the arch here and branch out like so to these little spots at the end of the phalanxes. So the posterior tibia to the plantar surface, as you can see right here, cut off right here though, of the distal and middle phalanges. The flexor hallucis longus originates here on the fibula, on the the lateral portion of the leg, and it also comes around, as you can see through here, around the medial portion under the medial malleolus to reach across and insert on the distal phalanx of the great toe, the big toe. Originating on the fibula and the posterior fibula, and then inserting on the distal phalanx of the great toe. So origin, insertion, action. What's the action of the flexor hallucis longus? Well, flexor, it flexes or points the toe down, the big toe down. It flexes. The hallucis, I told you, means big toe. So the flexor hallucis longus, it's got a big long tendon. So it's a long muscle that flexes the big toe. What does flexor digitorum longus do? Well, that's a long muscle flexing the digits of the foot, the other digits of the foot, the phalanxes of the foot. Same thing. Tibialis posterior, plantar flexes the ankle and foot, and it's called the tibialis posterior because it's on the other side or the back side of the tibia, as opposed to the tibialis anterior on the front of the tibia. Finally, two smaller muscles. One, the Popliteus muscle. Popliteus is this muscle right here, wrapping around the back of the knee. Wrapping around from the lateral part of the femur and into the medial portion of the tibia. And this muscle does two things. It actually flexes not the ankle, but the knee. It flexes the knee. And also, as you can imagine, rotates the knee in a medial direction. And it's important in unlocking the knee from an extended position. When you straighten the knee and you bend it, it unlocks the knee from straightening to bending. You can see its attachment site here is on the lateral epicondyle of the femur, and then reaches around here to attach to, as we said, the posterior proximal tibia. Of course, if you can imagine a string going from here to here, it would pull in this direction. And you could see how it would both turn the knee and possibly flex the knee as well. Lastly is a tiny little muscle called the plantaris. It is not known to be significant. It's actually known to be kind of an insignificant muscle, a mysterious little insignificant muscle here that runs kind of down here and then inserts into the Achilles tendon, as they're calling it, the Tendo Calcaneus. And it's long and skinny. It's medical freshman, they call it the freshman tendon. It's often mistaken by a nerve by young and experienced students when they dissect a body. And its job is plays a very, very minor job. It helps in plantar flexion. You can see it originates over here next to the lateral head. It originates here next to the lateral head of the gastrocnemius, and it travels down similar to the gastrocnemius itself and inserts right here into the Achilles, and then it's called the Plantaris muscle, right there into the tendon. And it is in certain percent so insignificant that a certain percent of the population doesn't even have it in their bodies. So there you have it, and that represents the completion of page 64, muscles of the posterior leg. This is Dr. Stephen Harkins.